Hello everyone, a very warm welcome to the Smart RN channel. My name is Henry. In our video today, we are looking at pneumonia, which is an infectious respiratory disorder. Pneumonia is simply inflammation of the lung parenchyma, and the lung parenchyma is that functional tissue of the lung. Inflammation is an immune response. It occurs when our immune system responds to invasion by microorganisms like bacteria, viruses, and fungi. And that process of inflammation is associated with edema or swelling. We have got heat in the affected area. We have got pain and even redness because of the amount of blood which is flowing to that affected area. Pneumonia is caused by microorganisms like bacteria, viruses, and fungi. Now remember we said that our upper respiratory system, or our upper respiratory tract, is composed of a number of defense mechanisms to protect us against pathogens that may enter the respiratory tract. But there are times when these pathogens are able to evade all these defense mechanisms, or the sheer large number of these microorganisms overwhelm our defense mechanism, causing them to be or to reach the alveoli and cause pneumonia. Now, we may take in these microorganisms via inhalation when we breathe in air, the air that contains microorganisms, or when we aspirate. We can aspirate food into the respiratory tract. We may aspirate drink. We may aspirate stomach contents like vomit. So all these are going to carry these microorganisms into the alveoli and cause this pneumonia. When these microorganisms reach the alveoli, they begin to proliferate or they begin to multiply. And when they multiply, our immune system responds to try and kill or eliminate these microorganisms because they are not wanted in that particular area, or they're not wanted in that part of our body. Remember, the lower respiratory tract is meant to be sterile. We do not even have any flora or any normal flora or resident bacteria. So when these microorganisms reach the alveoli, our immune system responds to try to eliminate them before they can cause any problem. So before we look at that particular inflammation process that occurs when these microorganisms invade the alveoli, pneumonia can be lobar. In other words, it can be concentrated in the whole lobe. It may affect only a particular lobe, or it may be diffuse, occurring in various parts of the lung. So this is lobar pneumonia, which is only affecting this upper lobe, and this is diffuse pneumonia, which is affecting various parts of that particular lung. So pneumonia can just be concentrated in one particular region, for example, only affecting a particular lung lobe, or it may be found in diffuse or in various areas of that particular lung. So this is diffuse pneumonia, and that's lobar pneumonia. So let's see what happens. Now, when these microorganisms arrive in the alveoli, we say that inflammation ensues. So what happens? Number one, we have got neutrophils and macrophages, which are normally recruited and moved to the alveoli to try and eliminate this particular microorganism. Neutrophils are white blood cells, so they are reproduced and moved or recruited and moved to that area of infection. Then we have got macrophages. Remember we said macrophages are normally found in the alveoli. They normally destroy bacteria or microorganisms by phagocytosis. They engulf them. So we have got many of these macrophages and neutrophils being recruited to go into this area to try and eliminate this invading microorganism. Another thing that happens, apart from neutrophils and macrophages moving to that area where we have the microorganisms, the blood capillaries become more permeable. Why? So that blood can easily move to that area and transport the white blood cells to that particular area. Even though this is an immune response which is meant to eliminate these pathogens, the problem is that when blood capillaries become more permeable, fluid or blood starts leaking into that particular alveoli. So there is blood now flowing into the alveoli, bringing the white blood cells to try and eliminate this particular microorganism. Now, when we have blood capillaries becoming more permeable, we now have fluid and exudate filling up the alveoli. So we now have actual fluid in the alveoli. We have pus or exudate, this resulting from dead microorganisms mixing with this particular blood. So we have fluid and exudate in the alveoli, and this one now is not very good. Why? Because it impairs gas exchange. So even though this inflammation is meant to try and eliminate this particular bacteria, even though it is an immune response, it brings a problem because gas exchange is impaired as a result of the fluid and exudate which fills up the alveoli as a result of that particular inflammation. So during inflammation, we have got neutrophils and macrophages which are recruited to that area where we have the bacteria or the viruses or the fungi. We have got blood capillaries becoming even more permeable to try and move fluid that is bringing the white blood cells to contain this particular microorganism. And then the fluid and exudate that fills up the alveoli impairs gas exchange. So when you have fluid and exudate in this alveoli, the ventilation perfusion mismatch occurs. Why? Because we have got more blood that is flowing to the alveoli to come and pick oxygen to be transferred to the rest of the body, but we have got very little oxygen that is moving through this particular alveoli because of this particular fluid. So more blood, enough blood comes to the alveoli, but since the alveoli is not functioning properly, only very little amount of oxygen is picked up to be transported to the other parts of the body. So we have what we call ventilation perfusion mismatch. So that's how pneumonia occurs as a result of this inflammation process that is a response to microorganisms reaching that particular alveoli. Now, we have got 4 classifications of pneumonia. Now, one, we have got community-acquired pneumonia. Community-acquired pneumonia is that pneumonia which is contracted outside hospitals and other healthcare facilities. If you contract pneumonia outside a hospital or outside a healthcare facility, then that one is referred to as community-acquired pneumonia. This is pneumonia that is found in those patients or on those people who have not recently been hospitalized. So that's community-acquired pneumonia. And then we have got hospital-acquired pneumonia. This is pneumonia which is contracted when a person is hospitalized for another illness, and it normally occurs after 48 hours of admission. So between 48 and 72 hours of admission, you contract pneumonia in the hospital. That is hospital-acquired pneumonia. So hospital-acquired pneumonia is that pneumonia which is contracted when a person is hospitalized for another illness in the hospital. It normally occurs between 48 to 72 hours after admission. Now, we also have healthcare-acquired pneumonia. Now, this is almost the same as that hospital pneumonia, but with healthcare-acquired pneumonia, this one is acquired in long-term healthcare facilities, in long-term care facilities like nursing home. Or it may also be contracted by those people who are receiving treatment in outpatient facilities like dialysis center. So this type of pneumonia is referred to as healthcare-acquired pneumonia. It's almost the same as this, only that this one, you get it in long-term care facilities like nursing home or outpatient care facilities like dialysis center. And then we also have aspiration pneumonia. This is pneumonia that occurs when we aspirate content or when we aspirate foreign particles into the lower respiratory tract. For example, we may aspirate saliva, we may aspirate food, we may aspirate vomit, or even drink. And this aspiration pneumonia will occur especially in those people who have a defective gag reflex. Remember, a gag reflex is meant to protect, it's a protective mechanism. So when you have a defective gag reflex, you are able to aspirate contents into the lower respiratory tract. We also have those patients who are having swallowing problems. They have a problem to swallow, so they may end up aspirating contents into the lower respiratory tract. Those people who are using excessive alcohol and drugs, there will be a situation whereby their swallowing will be problematic and they are likely to aspirate contents when into the lower respiratory tract. So aspiration pneumonia is that what occurs when we aspirate food, vomit, drinks, or even saliva into the lower respiratory tract. So what are the risk factors for pneumonia? We have got a number of factors that expose people to pneumonia. One, we have age. Those people or children under or equal to 2 years and older adults greater than or equal to 65 years are likely to contract pneumonia. And this is because in these children, the immune system is not fully developed to be able to combat this particular microorganism. And in this adult population, the immune system has become weakened as a result of age. The weakened immune system in these particular older adults will expose them to pneumonia. But just something you must know is that pneumonia can affect anyone. Pneumonia can affect anyone. Only that this age, this is a risk factor. These people are prone to get pneumonia when compared to people who are outside those particular age bracket. Number two, we have long-term care residency. Those people who are living in long-term care residential areas and, for example, like nursing homes, they are likely to get infected with this particular pneumonia. Then we have those people who are suffering from chronic respiratory diseases like asthma, like emphysema. Those people are likely to contract or pneumonia as a result of these microorganisms gaining access into the lower respiratory tract. Then we have suppressed immune system. Those people with HIV, those people undergoing immune suppressive therapy, the immune system is weakened that it cannot be able to fight this microorganism. We also have prolonged immobility. Those people who have taken too long, maybe because of sickness, they are not moving, they are just stagnant in one area or they are not mobile at all. They are likely to contract this pneumonia. Then we have got aspiration of stomach contents and foreign material into the lower respiratory tract. You are aspirating food, you are aspirating vomit. Now you are likely to get pneumonia because microorganisms are gaining access to that particular part of the respiratory tract. Then we have got exposure to air pollutants like gases and even noxious inhalants. And those patients who are hospitalized for longer than 48 hours, they are likely to get pneumonia. So those are the risk factors that can expose us to pneumonia. So what are the clinical manifestations of pneumonia? We have a number of manifestations that we can see in these patients as a result of being affected by pneumonia. One, we have got fever, we have chills, and even swelling. Our temperatures rise as a result of an infection. Then they may be tachycardic, the heart rate or the heart is beating very fast, and they also experience dyspnea. Remember, this pneumonia is happening because there is exudate and fluid in the alveoli. So gaseous exchange has been impaired. So they are going to experience dyspnea. Then we have got cough. And this cough can either be productive or it can be unproductive. They can produce sputum as they cough or there's no sputum at all. And then we have got pleuristic chest pain. They have got pain when they are breathing. They have got pain when they cough. So that's a sign that they could be having pneumonia. And then we have got purulent or blood-streaked sputum. In this productive cough, when they cough sputum, you find that this sputum has got blood in it or it has got even a pus in it. That's a sign that they could be having pneumonia. Now, these patients can also experience confusion or they can also experience mental status changes as a result of that particular pneumonia. They can be fatigued. We can also have myalgia, and all those kind of clinical manifestations. So how do we diagnose pneumonia? Pneumonia can be diagnosed in a number of ways. For example, we may have a complete blood count and we have got elevated white blood cells. When the white blood cells are elevated in our system, then that means that we have got infection. The number of white blood cells goes up so as to try and fight this particular pathogen. So elevated white blood cells are an indication that we have got this particular pneumonia. And then we also have elevated C-reactive protein. A C-reactive protein is a protein which is produced by the liver when we have inflammation in our bodies. So elevated C-reactive protein is an indication that there is inflammation going on, and that could be pneumonia if it is accompanied by these other signs that we have seen. And then we can also diagnose by using ABGs, arterial blood gases. Remember, arterial blood gas test normally checks the amount of carbon dioxide and oxygen in our blood, and it also looks at our pH. So when we look at ABGs, you are going to realize that these patients have got respiratory acidosis with hypoxia. Remember, in acidosis, there is elevated carbon dioxide because the carbon dioxide is not leaving our bodies. Then there is decreased oxygen, decreased partial pressure of oxygen. The oxygen is very low because we can't take it in oxygen properly because of the oxygen and the fluid which has impaired gas exchange. And then our pH also goes very low. We are acidic, our bodies are acidic. So elevated carbon dioxide will always result in a lower pH. And low levels of carbon dioxide will always result in a higher pH or alkalinity. So in this case, we have got acidity, respiratory acidosis, because the carbon dioxide is high and the pH is very, very low. So ABGs help us to confirm this particular pneumonia. And then we also have imaging studies. There are imaging studies that can be done to diagnose this pneumonia. For example, chest x-rays, they always show infiltrates in our lungs. Remember, infiltrates are those substances that are denser than air. So you see substances like fluid or pus or blood in our lungs will be shown as infiltrates on this particular chest x-ray. Then you also have CT scans. And CT scans are going to show consolidation or solidification of lung tissue because of the presence of those particular exudates or pus or any fluid in our lung. So these imaging studies like chest x-ray and CT scans can be used to diagnose pneumonia. We have also sputum cultures. We obtain sputum from these particular patients, and then they are exposed to tests in the laboratory to try and determine what microorganisms are found in that particular sputum. And this will normally help to try to find out which best medication can be used to treat this particular pneumonia. So these are the various ways in which we can be able to diagnose this particular pneumonia. So how do we treat this pneumonia? Pneumonia can be treated in a number of ways. We can care for our patients by providing a number of treatments. One, we oxygenate these particular patients. We provide oxygenation. Remember, gaseous exchange has been impaired in the alveoli because of the presence of fluid and exudate. So these patients need oxygenation because they are experiencing hypoxia. But let me say something, that great care must be taken when you are oxygenating those patients who have got chronic respiratory conditions like COPD. The drive to breathe in these patients is caused by the lack of oxygen. So they breathe because they are lacking that oxygen. So when you provide this oxygenation, be very careful not to oversupply the oxygen so as to kill that drive to breathe. So because if you oversupply oxygen to this COPD patient, then the drive to breathe goes down and they can die. So be very careful when oxygenating those patients who have or who suffer from chronic respiratory diseases like COPD. Number two, overhydration. Hydration helps to thin this particular mucus or the sputum, so for easy expectoration. Then we also have medication. We can medicate this patient. For example, number one, we can use bronchodilators. Bronchodilators are for dilating the respiratory airway so that they can be able to take in oxygen. We have, for example, albuterol. Albuterol is a short-acting bronchodilator. It acts for a short period of time. Then we have combivent. Combivent is actually a combination of two medications, ipratropium, bromide, and also albuterol. So these medications can be used to dilate the respiratory airway so that these patients can take in oxygen, or to help them get in oxygen, as much oxygen as possible. So you can treat this by bronchodilators like albuterol or combivent, which I've said is a combination of two drugs, ipratropium, bromide, and albuterol. Or we can treat these patients with antibiotics. And remember, it is always better to treat with antibiotics when you have drawn the cultures. We should be able to draw the cultures first so that before we expose the patients to antibiotics. Because when we draw the cultures first, we'll be able to determine what is the offending organism so that we can get the right medication. So initially, we normally use broad spectrum antibiotics. So once we have drawn the cultures, we give broad spectrum antibiotic to this particular patient because we have not identified the pathogen. But once we have identified the pathogen, then we can be able to narrow to what type of antibiotic is required. In the hospitals, for hospital-acquired pneumonia, we normally begin what we call empiric treatment. This is treatment which is based on experience, what has been happening when you have this kind of patient. So you draw the cultures and then begin empiric treatment. Then after the pathogen has actually been identified, then you can be able to narrow to the particular antibiotics which are required to treat this particular pneumonia. So that brings us to the end of this video on pneumonia. In our next video, we are going to look at the nursing interventions for these patients who are experiencing pneumonia. So if you are new to this channel, I just request you to subscribe to this particular channel. Also, drop a comment and like this video. From here today, it is a goodbye.